I know we're all continuing to run around, but we wanted to bring you here today to show you a presentation that we've put together. This is a request for a quote that we have asked from certain vendors across the US, across India, China, outsourcing some of our work that we do here in the clinic. What we're focusing on today is the outsourcing of our claims, of our billing, our processing, and the credentialing of our doctors. You know, this has become very much of a time-consuming, kind of effort into our clinic, especially as we continue to expand and to grow. We've seen how much we've grown over the last year and 2 years. We went from, one chiropractor to now we have 2, as well as physical therapists, massage therapists, and an MD on board. And the more doctors, the more physicians and therapists you bring on board, the more difficult, the more tricky claim filing and processing can actually be. So we want to take the time to show you our presentation and kind of show you where we can take this and how we can better our clinic and, outsource some of our workload that we have going on. So the first thing I want to talk about is just the purpose behind all of this. The purpose for us is a desire to outsource all of electronic claims and filing and credentialing to a third-party vendor. It often can be a heavy task to be able to process every single claim with all the different insurance carriers that we accept here in our office. And it is important to us that we accept all the insurances that we can be credentialed on, because we want to be open to our community and we want to allow patients to be able to afford to come to our healthcare clinic and to take care of their health needs. The purpose is that we want our doctors, the more doctors we bring on, is great. And we offer the opportunity to our patients to be able to come to our clinic, for their chiropractic needs and their physical therapy needs in one healthcare facility. The issue is bringing on so many doctors means that they also have to be credentialed in the insurance that we accept in our clinic. Medicare is the primary one, where you first have to be credentialed in Medicare to even follow up to any different insurance carrier. And this process alone can take up to 60 days. So we want the process to be as smooth and as quick as possible. And often when you have to do that within the clinic, as well as claim filing and billing, it's not the front runner. We're not as focused on it. Not saying that we're not focused, but we want that responsibility to be in the hands of somebody who's strictly focused on credentialing our doctors in the best timely manner possible. Also, we want, our submitting our claims, and especially the rejection of the claims. For example, Blue Cross Blue Shield rejected claims, you can sit on hold for a half an hour. When your call is finally answered, it can take up to an hour and a half to 2 hours to deal with 5 claims. You are only allowed to ask the operator 5 questions on 5 different patients. In one claim one EOB I receive alone from Blue Cross Blue Shield, there can be 20 pages, and there can be 15 different issues and rejected claims. So that can take me 4 to 5 hours to deal with those rejected claims. That doesn't allow me any other time to post payments or to deal with other bills that I have to get out. So being able to outsource that to another third-party vendor would save us a substantial amount of time to not have to deal with these rejected claims. We also want to look at our reasons for outsourcing. There always has to be great desires and great reasons for outsourcing for it to become, a more viable option. So as we see insurance with the healthcare industry continue to change, and we often see their requirements and their fees decrease through all of this. So we want to be at the forefront. We want to know when Medicare has changed its rates that our vendor can automatically send us those, those procedure codes, and we can manipulate them and put them into our fee slips to be adequate, to have the exact number, what we should be collecting from our patients, what the Medicare rate, is, and what the Medicare should be returning to us and our EOBs. So being able to be, well organized from a third-party vendor on these different requirements would be a top reason for outsourcing. You know, these rejected claims, like I stated, can often be time consuming. So having that ability for a vendor to, you know, manipulate these claims and to deal with them would be a great viable option to us. And as we bring in these different doctors, there are different requirements, there are different procedure codes. A chiropractor, you know, does a manipulation on a patient, and that is a procedure code in itself. When an MD does, you know, an exam, it's an entirely different exam. So having those procedure codes and the amounts from the credentialing would be a huge option to us and a huge factor in being able to process easily. And as our clinic has continued to grow, so has our patient intake. You know, forecasting shows that our clinic will increase up to a 35% annual increase in patients for all 4 attending physicians. That means a single increase for each different doctor. That's hundreds, if not 1,000 patients a year, and which is a wonderful growth for our company and for our healthcare. But it also comes with more insurance inquiries, more insurance questions and billings and claims and rejected claims to process and to go through. And, you know, just as we'll require, you know, a lot from our vendors, we have certain specifications. If we're going to spend the time and the money to outsource all of these different things, we have certain rules and regulations that we want that we want the vendors to follow in their contract. We know we require responsiveness and time compression and on-time delivery. Our lead time, we want that to be cut down to half of what it is right now in our billing here in the office. With insurance companies, you have 30 days to send invoices, 30 to 90 days. We want that to be strictly 15 days. We want the clinic to send bills every 7 days. They are EHR, electronically sent to our outsourcing company. And we want the vendor to process our claims on our electronic EDI claims with a 2-day processing hold. And we want these submitted to the insurance company. Now, once they're submitted to the insurance company in the clearinghouse, it is up to the insurance company to process these claims. So that sort of time is out of our hands. So the quicker we get it to them, the quicker we get a response. And once these claims have been received, we want them processed the same day. We want 24 hours, 24 to 48 hours. We want the claims processed and sent to the clinic, and the clinic to process them that same day. We're not just holding our vendors to certain specifications, but we're also holding our clinic to process these in a timely manner. And also there will be, you know, certain liquidated damages that can happen, and that unfortunately, if they do occur, all claims that are late by lead time specifications will seek reimbursement from the vendor based on the amount of reimbursement that was allowed by the insurance company. You know, with the contract that we are currently looking at, the supplier's rate is about 5% of all reimbursement that we acquire through each individual patient that comes through. So if they're not able to process in a timely manner, and they don't deal with rejected claims in a timely manner, then they will have to, you know, deal with the consequences, and that is not getting paid for it and reimbursing us that 5% that it took us outside of our lead time to obtain. And just like we said before, you know, the basic line we expect, the basicalities we expect from this third-party vendor is, you know, uploading our EHR files and being HIPAA compliant, NOTION compliant. We hold a high standard for our clinic, and we also want to hold that for our, you know, suppliers. We want to be socially, you know, corporate social responsibility is number one in our clinic, and we want to see it through our vendors. Following up and with dealing with rejected claims, credentialing our doctors, and allowing us easy follow-up, you know, vice versa with us and with them. They need notes, they need diagnosis codes. We need to turn that around in 24 hours, as they need to turn around our questions and our communications within 24 hours. You know, one of the biggest risk factors can be communication, especially when dealing with outsourcing to different companies, different countries. So it's really important that we keep that open communication, and, you know, we take each other, you know, with respect and dealing in any way we can, and also in helping. Our required supply chain course. They'll be required, on our half from the patient to the front office to the provider to our billing office. We want that submitted in a timely manner to the billing office in the selected country, which will scan and charge the entry, as well as claims transmission to the clearinghouse and insurance company. After the communication of decision or the claims, we want the payment or the denial to be either dealt with or processed to our billing office in the United States. And that's submitted and posted in a timely manner as well. The schedule for these contracts, we're starting start date June 1st, 2015. We want to determine the contract to be 2 years at this point. We want to see, a year doesn't give you much to go on. We want 2 years to be able to fully look at the report, look at the revenue, look at how much we've had to spend and the process and the time, the lead times on this. Is it worth what we're doing? And we believe that it is. We want this contract to only be effective once HIPAA and OSHA standards are shown, prevalent in our vendors. This is a high standard for us. We want it to be a high standard for them as well. All bids we wanted and were submitted by May 1st, 2015. And so the best, most recognized company that we were able to, deal with and to be able to find and, communicate effectively was a company called Outsourced to India. It is a wholly owned by Flat World Solutions. It's been in service since 1999. It specializes in healthcare, Medicare billing and coding, claims adjusting services, and credentialing. As far as the assessment of the supplier, they are third-party certification. HIPAA and OSHA standards is required by them themselves in every country that they function in and that they process in. They require their building and that supplier, that vendor, to have the appropriate standards set up in our office, which is very important to us. Their reputation holds them very highly. Reviews of companies stated that labeled as being one of the best data services on the web, who have continued to expand and to grow into such a large company that has shown it is, taking the healthcare industry by storm and allowing these great services for a great price and great quality. It has the evaluation of the products. Outsourced to India has provided the clinic with appropriate reports and analyzed data, as well as past company evaluation of vendors. We've seen many healthcare clinics and hospitals that have used them, and the turnaround that they have shown has been absolutely within our lead time, if not quicker in some cases, which is absolutely fantastic. So, our real recommendations here is that, dealing with an outsource with a third-party vendor, will provide improvements to the billing and filing of claims, as well as the continued credentialing that is needed for our clinic. With a forecast of 35% annual client increase, the need for more attention and faster billing and rejected claim filing, will have to be kept up appropriately in a timely manner. Otherwise, we fall behind, we lose our patients, we lose our referrals, and we don't want that to happen. The time that this will free up for our clinic staff will allow for greater detail in insurance verifications and MRI authorizations, as well as physician and patient interaction. It'll allow us to market ourselves, in a bigger and broader sense. We want to stand out as a health clinic and a chiropractic clinic and an MD and physical therapy. The growth of our business, continues to increase to new heights, and we want it to. The price of these vendors, it's just, it's outweighed by the time that we would be able to be committed to our patients and to our staff and to our facility just in general. So we really hope that you keep this in mind and just know that, outsourcing to a third-party vendor doesn't have to be difficult, and it doesn't have to be time-consuming. It's supposed to be there to help you to be able to allow your company and your clinic to expand and to grow, at a more rapid pace and not have to deal with certain things. And, we believe that this will allow the company and the clinic to be able to better process and better handle the situation and to grow and allow us more time to spend in different areas and taking care of our patients and our clients and our doctors. We thank you for being here today, and we hope that you take this into consideration. Thank you.